Hey everyone, welcome to exercise 2A. We're going to do a side lying release, and it's going to be a thoracic rotation. If you have a block, grab your block, or if you don't, you can use a pillow or a bolster, anything you can squeeze between your knees. And if you'd like a little rolled up towel, this might feel good for in the crook of your neck. So come down to laying on your right side. Again, you can place that towel roll here underneath your ear or your neck. And we're stacking our pelvis and our knees on top of each other, left on top of right. From here, place your bolster or your block in between your knees. I like to do it kind of at the lowest or the middle setting. Okay, so we're having a bit like a 90-degree angle at our hips and our knees, and stacking left shoulder on top of right. Okay, so take a deep in-breath here. As we've been doing, 360-degree breath, let it go all the way down to your pelvic floor, the low back, the sides of your waist, the rib cage and belly, and into the chest. Big full breath here. And then actually let's just stay for a few because we need to learn how to breathe in this side lying position too. If you want, you can also place your towel roll on the right side waist here, so that you don't feel like your left hip is sagging. So lots of options here. A couple of deep breaths. Think about breathing into the back of the sports bar area, the rib cage. And even if you don't feel like you're able to breathe into the back body, just set that intention there and see if that doesn't help you increase just a little bit. Just having the intention and the direction. Good, another full in-breath. On an exhale, gently squeeze the block between your knees, and then slide your left hand down your right arm all the way open to the left. So we're finding a twist here. Take a peek, make sure that left pelvis is still stacked on top of the right. So we're twisting from above the navel, the belly button, and the rib cage and the thoracic spine area. Really stretch out through the left fingertips to the left side. Your gaze can follow, or you can stare straight up at the ceiling. And then deep breaths here. 360-degree breaths here. This is really good for opening the thoracic spine, the mid-back. Again, this creates more space for air so that we're not totally, when we take an in-breath, biasing it only towards the pelvic floor or the diastasis. So once you take a few deep breaths in your twisted position, we can start to move with the breath. So on an inhale, come back to your starting point, stacking left shoulder over right and releasing any squeeze you have on the block. Big breath in. And then exhale, gentle squeeze of the block, and then peel open to the left. Inhale here. And exhale back to your starting point. So kind of a 4-point breath here. Deep breath in your side lying position. Exhale to make your way through your twist. Gentle squeeze of that block. Think about rotating your rib cage from above your belly button. Breathe in here. And exhale back to your starting point. And we'll switch sides. Come onto your left side. Place your towel roll either on the left side of your waist or under your left neck, your left ear. And a couple of breaths to start just in this side lying position. Close your eyes if that helps you with your picturing of your breathing. See if you can practice your 360-degree breath without my cues. One more deep breath in. On an exhale, gently squeeze right thigh on top of left, keeping right hip stacked on top of left, and then peel your right shoulder open towards the right side. Your gaze can look up at the sky or towards your right thumb. Press out through your right fingertips here. Breathe in. Really fill up through the rib cage here. Breathe out, stay. 2 more cycles. Breath making its way all the way down to your pelvic floor, feeling that slight descent of your pelvic floor. And then our exhale is a gentle release. One more breath in. Good. Come back to your starting point. We'll do a couple where we move with the breath. So inhale in your side lying position, right hand stacked on top of left. Exhale, gentle squeeze of the block as you twist open to the right. Take a breath in, stay here. Take a breath out as you return to your starting point. And again, you can peek along the way. Make sure that right hip is stacked on top of left. We're not opening through the pelvis. We're biasing it towards the spine, the mid-spine. Breathe in your side lying. Breathe out to squeeze and twist. Inhale, stay here. Reach out through the right fingertips. And exhale back to center. One more. See if you can move through that 4-part breath at your own pace. Okay. Hopefully you feel like you created some space throughout your thorax and your torso here. Again, the more space we have throughout our whole body, the less pressure gets biased in one particular area. Okay, I'll see you for the next class.